Dr. Mauro, next year in April, the Tomen Medical is organizing a conference where you are the main lecturer. And we know that the conference will cover a lot of very interesting topics. As a moderator, I know that we divide it into some stages. First, we would like to know what is your opinion about planning and digital dentistry. It is hot issue now
Yes.
or not? What do you think about this, and will you talk about this problem or this topic during the conference?
Yes, for sure. But before to answer to your question, let me say that it will be a pleasure again to come back in your fantastic country. And as usual, everything that I face with the organizer, I come here with great facility, great thanks, because it's always a pleasure. Regarding your question, well, I will touch several points, but let me start speaking about digital dentistry. I started to work with digital dentistry exactly in 2003, thanks to a great professionist and researchers. His name is Daniel van Steenbergen. Daniel van Steenbergen has been probably the first one to start to work with digital dentistry, in digital dentistry. In fact, he started to propose the surgical guide, and in 2003, when I came back from this opportunity, I was immediately identify a patient, and I treated the patient. So from that time, I acquired a lot of experience in digital dentistry, and I will try to transfer in my lecture in next April here in your capital regarding what I've learned in the past and what we may improve thanks to the surgical guide, and I will describe exactly my experience. In other terms, up to now, we send the virtual plan to a company to produce the surgical guide, but 2 years ago we wanted to learn how to perform in-house the surgical guide. So I will describe in detail how you may perform the virtual plan for sure, but then how to produce in-house.
You mean surgical stand?
The surgical stand.
But it is milled. It's
Yes.
by CAD-CAM, in the CAD-CAM technology? Or?
Using CAD-CAM technology, but in this case using a stamp 3D, a 3D printer.
Just 3D print.
3D printer, and you know, it's much less expensive. It's cheaper, extremely cheaper to produce in-house the surgical guide.
We know that working with surgical guides is much easier, much more predictable, but during the conference you will also mention something about the maybe new surgical techniques, or maybe using growth factors. Will be also the topic of the conference?
Yes, for sure. I will transfer the experience acquired using the concentrated growth factors. Concentrated growth factor is similar to PRF, LPRF, just different the device to produce the membrane. But the concept is more or less similar. I will transfer our experience, our data, how to may improve the healing process regarding the soft tissue as well as the hard tissues. And so in the first part of my seminar, I will invest time regarding diagnosis, regarding digital dentistry, regarding the new surgical procedure for as well both bone augmentation as well as soft tissue management.
And what about prosthetics? Will you talk about something new, or do you create tissue with using some temporaries to get an emergence profile? You mentioned about marvelous lecture today about zirconia bridges, but you use only zirconia bridges. Do you think it is a good solution? Don't you have any problems with breaking such a constructions or chipping the ceramics? It's very often
mentioned in literature.
Mentioned in literature.
Yes, you are right. Adam, I publish just last year a very important, to my opinion for sure, a randomized clinical trials. One of the important papers in prosthetic area in which we evaluate the performance of zirconium framework covered with different layers of materials. Ceramic versus composite. This paper was designed in 2011, means 7 years ago, and was published in 2017. At that time, our experience with the zirconia was not so positive. Why? Because we haven't enough capability to create a perfect luting between the laminate and the zirconia. Today, the new technologies help us a lot in terms of reducing the minor biomechanical complications such as the chip that you mentioned before. Using full zirconia, milling full zirconia, and try to be extremely precise in the fitting of the framework.
You're right, but we also use full contour from zirconia construction, full contour constructions, but we know that until we have the multi-layered zirconia, the aesthetics without appropriate cutback was not sufficient. So do you think, I think it's the future of our restorations. But still, I think that full contour zirconia bridges are not as nice as full ceramic when we use much more translucent ceramic.
Let me say that I think that this is a good sentence, because I'm not completely agree with you. And I think it's extremely useful that you will be my moderator, because we may transfer to the participant different vision, but thanks to the image and thanks to what I will show, and I hope that you will show with me some cases, we may compare, for example, a feldspathic material versus full zirconia, for sure infiltrated, and when necessary using the cutback solution. And we will check. And why I'm convinced that is not the future, but it's the present, because it's cheaper. And in the meantime, I can't offer long-term perspective, because we have with this new material only 3 years of experience. But in the last 3 years, comparing our data in the past, the situation is extremely improved. We haven't enough data regarding TMJ problems. That is another aspect. But in terms of precision, in terms of functionality, masticatory function, the patients are extremely happy.
I think there's one more advantage of full contour when we can check occlusion on provisional grounds, and we can mimic it very precisely, what was not possible in feldspathic ceramic. So I think it's very big advantage of this kind of treatment. Also, I would like to ask you about another problem. I think that the occlusion is very hot topic now, and also I think that people, dentists, don't only think about teeth, they also think about nice face. So we were talking a few minutes ago about the face soft tissue analysis proposed by, for example, Arnett and McLaughlin, which is really very popular in Poland now. So do you use this analysis, or maybe what do you think about the whole treatment of teeth and face? Is this a good concept?
Absolutely, I totally agree with you, Adam, because this is the new step. I like to mention one of my great mentors. I'm speaking about Albino Triaca from Zurich, Swiss. I working together with him for more than 12 years. And at the time I participate to several conferences and courses ordered by Arnett and McLaughlin. And at the time we started to use with their software. I can mention Dolphin, for example. And we try to transfer those concepts in our daily practice. That means that we started to work together with a dermatologist, with a plastic surgeon, with a maxillofacial surgeon, working together in a big team, evaluating not only the lower third of the face, but even the middle part of the face. And I will show during this course how to manage this area, how to manage, for example, using liposculpture or using filler material, and how we may evaluate from a diagnostic perspective which kind of treatment modality is the most appropriate for the patient defect, for the patient improvement. So this is a new step. We need to work in our field, but more frequently working together other colleagues.
I'm really glad because you are a periodontologist.
Yes.
I am a maxillofacial surgeon, and we both have the same vision, that interdisciplinary approach and cooperation of the whole team. I think that is really very, very important for our patients and for achieving very good aesthetics.
So it will be a pleasure to share with you the podium in the next April here in your capital. Thanks, Adam, for your
Thank you very much. It
kind
was also
question.
a pleasure for us, and we are waiting and looking for this conference.
Thank you so much. Bye.